Hey, it's Scott. And I wanted to go ahead and just quickly touch on performing crics. And a cric, remember, means you have a choice of A, watching somebody be dead, or B, going ahead and having some variation of cutting their neck. Because your king, your LMA, your IGL is not cutting it, you're unable to bag, you're unable to tube. Again, your option is watch them die or do something. And if you're going to cric a kid, most places do some variation of a needle cric. And if you're going to cric a big person, most people now do some variation of scalpel, finger, bougie, or something of that sort. However, just as a quick trick, when it comes to where do we cric? In gentlemen, it's very easy because if you've got a nice smaller neck, you can tip their head back, you can see that big old Adam's apple. And if we look at the pig, this hard piece right here is your Adam's apple, otherwise known as your thyroid cartilage. This next hard ring right below it is your cricoid cartilage. And this nice soft valley between the two is your cricothyroid membrane. The other way you know that this is where you're going to cric is this amazing thing right here called a safety pin. So with that, we have a nice membrane between the two, and that's where we're going to cut. And remember, if you look at the membrane, it goes horizontally. And the easiest way to remember that is if we look down here and you see your tracheal rings, they all go horizontally. So the idea being that if you're going to cut to the point that you're actually putting the tube into the neck, at the end of the game we cut horizontally, because why cut through all of these cartilaginous rings or cutting through thyroid, through cricoid cartilage if we don't need to? So with that, a neat trick. When you're trying to remember, do I cut vertically first or do I cut horizontally first? Because in gentlemen, it's easy to find their Adam's apple and where you're going to cut. In women, it can be far more challenging due to the lack of an Adam's apple. And even worse, in a trauma situation where everything is seriously swollen, it can be really difficult to find landmarks. So with that, we cut vertically first, then horizontally. And an easy way to remember this is if you are honest and you are performing a cric. At that moment, you are going to become very religious. And the easiest way to remember vertical then horizontal is you are now praying, please help me get this airway. And in the Catholic faith, remember this, then this. Vertical, then horizontal. Same idea applies here if we're going to do some variation of a surgical cric. Whereas we cut vertically so that we can go ahead, get some of this tissue out of the way, and actually say, there is the trachea, there is the area that I want to cut. That's why we cut vertically first. Then once we've identified the membrane between the two, the membrane is going horizontally, so we cut horizontally through the membrane as well. So in the horrible event you have to cric somebody, whether it's scalpel, finger, bougie, or some other technique, if you have to go ahead and perform the cric, become very religious, vertical, horizontal, and do what you need to do.
Scenarios in Seconds was designed to be a simple and effective way to regularly train for pediatric emergencies. A Navy SEAL said it best, under pressure, we don't rise to the occasion, we sink to the level of our training. Ultimately, your next PEDS patient could be your worst PEDS patient, and we don't want you to just get ready, we want you to stay ready. And Scenarios in Seconds was designed to help you do just that.